Well, I mean, you tell us how we're going to spot a gluteal tendinopathy.
So there's quite a common site of pain. So we're looking at pain that's over the lateral hip. It can spread down the lateral thigh, right. Sometimes to the knee, because the ITB does get involved.
So if you put that slide up, we'll have a picture on the screen.
That would help, wouldn't it?
There we go.
There we go. So generally, this is the sort of main site of pain over the greater trochanter, which we'll sort of look at more on the model later. And this is the kind of general area that we will see. You can get some buttock pain with it. Obviously, the gluteal muscles sort of sit around there, and occasionally the groin. But generally, when we say groin, it's not actually that sort of C-sign type pain that we see with an arthritic hip, for example, or that articular pathology.
I think it might have been when you were on last time. We were talking about the site of pain for the actual socket itself, and it's a lot deeper than most people think, isn't it? It's much more medial, much more in towards the groin.
You're absolutely right, Stephen. So it's much more medial, and people tend to point in their groin or do this kind of a C-sign type arc, which is quite a good indicator to say actually this is more likely to be driven by the hip joint.
Yes.
It's unusual we get that kind of pain with this condition. If we are sort of seeing that, we'll probably think, well, actually, we need to have a look at the hip joint in more detail. Yeah. And there are certain tests we can do to have a look at that. But yeah, this is the common site of pain that people would present in clinic with. And it can go down to the knee, but doesn't go past the knee.
Right. Well, you preempted me to a certain extent, because obviously I saw your slides before we started the show, and I looked at that little pink oval there, that ellipse, and thought, well, surely that's going to be misdiagnosed as TFL, or it's going to be misdiagnosed as trochanteric bursitis. So how often are you seeing misdiagnoses like that, and how common do you think it is that practitioners like ourselves, let alone GPs, will misdiagnose it?
Very common. So trochanteric bursitis is the traditional term for this condition, but we know now that actually there's only about 8 to 20% of cases of gluteal tendinopathy that present with what we now call bursal distension. So we've kind of moved away from the bursitis, because actually the current way of thinking is that actually isn't an inflammatory driven process. So you tend to find that the bursal distension occurs with gluteal tendinopathy, not as a standalone condition.
Right.
So, but very often it's diagnosed as gluteal.
I'm fascinated to hear you say that, because I can remember, vaguely remember, I think we did a show like this long before you first came on the show, and somebody was saying that trochanteric bursitis is grossly overdiagnosed. It's almost never the cause of pain in the hip.
Absolutely, absolutely. Yeah. So it's very rare that it's a standalone cause, because there's a reason why the bursa has become swollen or distended, and it's usually due to compression, which we will talk in detail about as we go on.